Okay, so for example, in Singapore or in Asia, our smoking rate is quite low and our percentage of non-smokers are quite high. But in the US, the smoking rate is higher. So so if you look at this, I should have circled this. So in our patient, if you look at the different mutations, the gene change, we have a big group of patients with this thing called EGFR mutation. Okay, but in the US group, the EGFR mutation is quite low at 11%. Okay, so in terms of treatment, there are treatment that targets this EGFR mutation, and so there are some slight differences in the treatment because the gene profiling of the cancers are quite different. Okay, so in summary, okay, what I mentioned just now. So the most important risk factor for lung cancer is still smoking. Okay, lung cancer is the number one cancer killer among Singaporeans. Lung cancer presents at late stage, and early lung cancer has no symptoms. Okay, and if your lung cancer is diagnosed at early stage, the outcome will be better. Okay. Never smokers can get lung cancer, but the risk of getting lung cancer is still higher for chronic and former smokers than never smokers. Okay, and women can also get lung cancer. Okay, and usually the women are non-smokers because our smoking rate among women is actually very low. But unfortunately, the smoking rate among teenage girls is relatively high. Okay, so my last part is just a quick one on lung cancer screening. Okay, like I mentioned, if you detect the lung cancer early, the outcome will be better, the patient will survive longer. So at the moment, how can we detect lung cancer early? Okay, so far the only test that has been shown to improve survival of lung cancer by picking up cancer early is a low-dose CT scan called Ldct. So this is the Ldct. So you can pick up this lump, which is the early lung cancer, then you remove it. So the treatment will be just surgery. So what's the benefit of Ldct? It has been shown that it can reduce lung cancer deaths by 20% as compared to chest X-ray. Because chest X-ray is may not be so easy to pick up the small lung cancers. But at the moment, the application for Ldct or recommendation is actually for people between 55 to 74 years old and currently smoking or quit or are ex-smokers, and then they smoke quite a lot, at least one pack of cigarettes a day for 30 years. Okay, why this group of patients? Because not patient, a group of people is because their risk of getting lung cancer is very high. So the chance of picking up the lung cancer is also very high. So this is the group that should go for this thing called Ldct. Okay, but there are some downside to the Ldct is that you may pick up false positives. That means when you do the low-dose CT, you may pick up nodules, but they are not cancers. So it makes you patient and anxious, worry a bit about what it is until the patient go for biopsy. Then there's also exposure to radiation, a small amount of radiation. Okay, so of course the best thing to do is not to smoke, and then also say no to secondhand smoke also, because secondhand smoke can actually have a risk of getting other problems. Okay, this is just a team. Okay, yeah, that's all I have. So now maybe we open the floor to the question answers.
Dr. To, we have a question for you in the chat box.
Okay, let me have a look. Hold on a while. Let me see. Okay, I'll just read out the question so that everyone can know what question is. Okay, this first question is: would the spontaneous pneumothorax patient that continues smoking have a higher risk of CI? I presume that's CA, is it? Or, is it? Okay, maybe talk about this spontaneous pneumothorax. Pneumothorax is actually air leak into the airspace in the what you call the pleura lah. Yeah, and who gets spontaneous pneumothorax? There's a group of patients who get spontaneous pneumothorax who don't smoke. These are people who somehow they're prone to this pneumothorax, and they are usually people who are very tall, lanky, and skinny. They are somehow at a higher risk of getting pneumothorax. Then there's another group who get pneumothorax because of chronic smoking. Okay, because when you smoke too much, they have all these air bubbles in the lung. Then sometimes they will burst. So the risk of getting lung cancer is more related to the amount of smoking the patient has, not related to the pneumothorax. So they are the pneumothorax is not related to the cancer. It's just that they have the same factor, which is smoking. Okay, I hope I answered that question. Then, so
Hi everyone, Dr. So can I share my opinion?
yeah, sure. Sorry, where?
Yeah, my name is Sunny.
Hi.
Okay, I'm a smoker for 23 years. I have 13 years of smoke-free life. And the reason why I quit is because I realized when I was in China, smoking industry is about making money out of every one of you. So at the end of it, you pay and you enjoy the thing, you smoke it out, and then you suffer about it. You lose a lot of money, and those businessmen will make money out of every single one of you. So it is like 13 years ago. My health has improved. I have my IPPD goal. I run, I swim, I cycle. It is all because I love my family, my children. I want to live longer. This is the reason, to see my children, to see the world more. And I hope everyone can see to this and build up the courage to quit. And that's all I have. Thank you.
Yeah, thanks for sharing. Actually, you're right. The one who benefit most is the company, the smoking tobacco company. That's why they shifted to the tobacco-less smoke. Okay, so you should still be careful about those products. They can also they also are related to lung cancer because they are quite new, but as long as they have the same type of product in the tuberculous smoke, it can still cause problems later on. So it's best not to start. Let me see. Yeah.
I ask you a question. Do you have you any experiences when you treating divers with cancer?
Sorry, say again. I couldn't catch that.
Do you have any experience of treating scuba divers with lung cancer? Any experiences?
Oh, scuba divers with lung cancer. You mean if they have lung cancer, whether they can still scuba dive, is it?
Mean you say, are there any patient that is a scuba diver?
Oh, okay. So far, no. I haven't seen one who's yeah, is a scuba diver, like actively scuba diving. Because actually most lung cancer patients are usually after the risk goes up very high after 50. Yeah, so I think most people after 50 they don't scuba dive anymore. But so the younger ones, they are not so common. I mean, lung cancer not as common in the younger ones. Although there's a group of non-smokers with lung cancer they do get the lung cancer at about 30 odd. That type of lung cancer is quite a bit different. There are certain gene changes. Somehow they get the cancer quite early when they're younger. They're not related to smoke. Yeah.
Thank you, Dr. To.
Yeah.
Everyone, do we have any more questions for Dr. To?
In the chat, I don't see any other questions other than that.
Yeah, so far there's only one question.
Okay. Does anyone else have any questions? You can just ask.
Hi, Dr. To. It's Sunny again.
Hi.
Yeah, I was with the chemical metallizing company for 2.5 years. I realized our body has statics, electricity. So when I plate on metal and it builds up, it grows. It grows be it nickel or copper on the substrate, on the metal itself. So what I mean is that if we were to smoke and put chemicals in our body, especially our bloodstream that carries hemoglobin and so on, carry oxygens, and it carries the rest of the chemicals. With these statics, I believe that you will grow tumors and so on. Is this a myth? Because I see on the in the engineering industry, in the medical side, would you able to answer these questions?
No, actually, I cannot answer that because about static electricity, I'm talking about that they can actually cause tumor growth, is it? Yeah. I don't know of any studies on this static electricity and cancer, especially lung cancer. Yeah, I don't know. Yeah.
But because I saw that happening before my eyes, so that was one of the first trigger that stopped me from smoking. Because I believe everybody has a form of energy on every one of us. Because when we pass by sometimes each other, we have these statics, and then shock to each other.
Yeah.
So this one actually caused a little bit of metal buildup in your blood. I mean, water is to build something into your system. That is what I worry, and that's why I asked the question with some of the professors, and then the answer was that yes, it will grow when there's electric.
Okay. I'm not sure about that because I'm not sure what studies there are, but I know that there are some people who believe in it, and then they go for these what do you call those the magnetic type of treatment. But I don't think medically there are any studies who says that this is actually related to cancers. Yeah.
Thank you, Dr. To. The final word I want to say is that no doubt it is there's no concrete answer to it, but I think that as long as electric and towards metal plating, in a human being, we have all sorts of minerals in our body. We have copper, we have nickel, we have irons in our body.
Yeah.
So this is one of the things that you should consider about. Do not dirty your blood. My main end is don't dirty your blood with smoking habits.
Okay. Good. Thank you.
Hi, morning, Serene here. I agree with what Dr. said. In fact, both my parents are smoker, especially my mom was heavy smoker. She was diagnosed with MPEC and passed on. My dad, although he quit smoking after giving birth of me, but he also diagnosed with lung cancer after like 30 over years. So be it you are a smoker or a second-hand smoker, because my mom smoked so much, in fact, all of us become a second-hand smoker. So turn out our body has certain mutation that, especially my dad also a former smoker. So both of them, when my dad was diagnosed with lung cancer with a stage 4, it was too late for him to even recover.